Hi, I'm Doug Lawrence, Vice President of Client Relations for Healthcare Anywhere. And today I'm going to walk you through how to log into the Healthcare Anywhere web application and describe the steps that it takes for you to be able to schedule and participate in a virtual visit. Step one, you're going to log in, and what we at Healthcare Anywhere do is white label your individual practice that will show you the logo, colors, and key messages that you want to present to your clients so that they have that same familiarity they do when they walk in the front door. The domain or URL will match the individual physician brand, such as if it were Dr. Oliver, it would be droliver.caria.com, so that the physician and the patient both know that they are in the right location and where they're supposed to be. All right, to get things started, you're going, as a provider, you would enter your username, your password, click login, and you're going to be presented with the physician login screen. Next, after logging in as a physician, the physician has the opportunity to view their upcoming appointments. They can also log in so that the patients can see them, knowing that they're ready for either instant or upcoming scheduled appointments. They will see their appointments are organized chronologically by time. As they see one of each of these patients, they can triage or look at their chief complaint form or why they're being seen prior to actually seeing that patient. Once the physician has logged in, the physician will make themselves online so they can be seen by patients, so that they can be scheduled for instant visits. Once they've done that, they'll be able to see future visits. They'll also be able to see patients waiting and be able to look at the chief complaint form of the upcoming patient so they can know why that patient is coming in to be seen today. Step three, the next step, is where the provider can actually see the patient. We use 2G to 4G connections so that we can see patients anywhere. We have real-time messaging and voice for the video. We can also communicate with that patient via photos that the patient uploads and sends to the provider so that they can be reviewed and saved for future use. Now we see the actual visit between the provider and the patient. The provider is the small self-view screen in the lower left. The large screen is the patient. They can see one another. They have the tools to the left so they can conduct a text conversation, look at notes, snapshots of the patient, chief complaint form, along with other tools that can be used. Step four, after we've completed the visit, we have a number of options that can be performed. One is e-prescription, where the provider automatically transmits the prescription to a nearby pharmacy so the patient can easily pick it up. We also have speech-to-text notes so that the provider can dictate the post-visit notes that are automatically saved into the medical history. We securely archive that session, screenshots, and other information that are captured during that visit. We also provide credit card billing so that we can automatically collect copays and full payment, reducing the revenue cycle efforts for payment collection. So after the visit, the provider has the opportunity to be able to perform speech to text so that the post-visit notes are transcribed from the physician speaking. We can also record notes that need to go to the nurse directly. We can end that transcription, then we have the ability to actually charge for that payment. After the visit and after the payment have been retrieved, then we have the ability to analyze the patient data. For example, the average patient visit time, either by provider or by the entire practice. We can also look at total visits, so we provide a wide view or a narrow view depending on what the practice would like to look at for their needs and how they do business today. We have a tremendous number of ways to manage provider's schedule, the practice's schedule, be able to look at what type of information and data has been collected for metrics. We have the ability to customize for that practice exactly how they do business today, but give the patient and the provider the opportunity to see one another from anywhere. Again, I'm Doug Lawrence, Vice President of Client Relations. I invite you to reach out to us so we can perform a live demo. We'd be happy to be able to customize a solution for your practice. Thank you for your time.